you ever think about how our body is interconnected? How one thing may impact many different aspects of our mental, physical, social, and emotional health. That's why when we say we're the Holistic Travel Therapy Podcast, we like to look at the person as a whole, not only just their physical symptoms, what conventional medicine usually looks at, but their social well being, emotional well being, mental health, and physical health, which all make up who that person is and how they function. Thank you guys so much for tuning in to this week's episode of the Holistic Travel Therapy Podcast. My name is Courtney Condon, occupational therapist.
And I'm Jon Wilson, DPT.
And we wanted to bring to you this week's episode about what the heck does holistic mean. I think that it is a kind of a big buzzword that's thrown around now because it is getting a little bit more attention and people are wanting to make better choices for themselves. They're wanting to take control of their health. And that's an amazing thing. And we wanted to kind of educate you guys on why we've started to focus on that more within our own lives and also within our patients' lives when we're treating them in the clinic, in rehab, in the home, and things like that.
Yeah, I mean, growing up, it was always just treat the symptoms. If you have pain, you take ibuprofen. If you
Right.
have this, you do that, So the holistic way is really looking at the whole. Obviously, we're going to be looking at physical health, mental health, spiritual health, just everything kind of combined into one. Because, like you said, there's a lot more research coming out that there's just so much that goes into it more than just, okay, I have some shoulder pain or I have some stomach pain or I have some low back pain, which is huge, something that I see all the time in the clinic. And, you know, managing stress and diet and all that kind of stuff. At first, you don't think that that has anything to do with low back pain or
Right,
shoulder pain. It
exactly.
just doesn't make any sense. But when you really break it down and you start talking about inflammation, is what we talk about all the time, you really kind of look at it at the holistic way and you see that it all is interconnected.
Exactly. And that is a perfect example. I think what really resonates with me is being an athlete at a young age. I was, always active. I in high school did a lot of running, multiple sports, volleyball, played on uh, rec volleyball leagues and things like that. And about my sophomore year, end of my freshman year, I started getting really bad shin splints, plantar fasciitis in both feet, like you name it, I had it as a runner. And, it was just like, oh, let's just treat, your foot hurts, let's just treat your foot. Your shin hurts, let's just treat your shin, which was all, my coaches, my doctors, everyone knew at the time. So I'm not blaming them, but, no one was ever really looking at my stress levels, my diet, all these things that, as Jon mentioned, have a direct impact on your body and the way it functions. One study that I looked at saw the correlation between stress and injury risk in college dancers. So they looked at their coursework, their stress management, and then their performance throughout the semester. And they saw that during periods of time where maybe they were doing exams or stress was higher, their incidence of getting injuries was also increased. So that is like what I really think, unfortunately, is going on a lot of the times when we have people come into the clinic or to rehab with chronic pain, that there are other areas in their life that are directly impacting that pain. And unfortunately, they're not seeing it and the physician's not seeing it. And they're going through this chronic pain cycle. And I think that it's so important that we educate people on this because unfortunately, the way the medical system's set up right now, it's hard for us to have a person come into the clinic with shoulder pain and we're like, so, how often are you eating fast food? Have you ever heard of the Mediterranean diet to reduce inflammation? We can't really do those things, but we can always educate on, healthy lifestyle choices, stress management, things like that, because it is so important. So we want you guys to know these things so you can take better control of your health as well.
Yeah, and the amount of people I see in the clinic who talk to me about how stressed they are and how much stuff they have going on with work, with their family. I mean, it's unbelievable. And it's directly correlated with having that chronic low back pain or having that chronic knee pain. And, the more they come in, the more I start talking to them about, okay, how much sleep are you getting a night? Are you getting that 7 to 9 hours? What are you eating? Are you eating a lot of fast food? Are you getting your magnesium, your sodium, your calcium, all that, the good nutrients that you need? Um, because when you really break it down, it's inflammation. And if you're not doing the right things, if you're not getting, sleep, you can do as much physical or occupational therapy
Right,
as you
exactly.
possibly can, and you're not going to get any better. Um, and that's where, if you just treat the symptom, that's where it comes back to that holistic way. If you just treat the symptom and continue to do all those other things, because I know people who are on, you know, steroids long term,
Right,
are
yeah.
on, taking painkillers long term, and sure, they're like, oh, I don't have any pain anymore, but the long term effects of that is even worse, and it's starting to come out because there's a lot more research coming out now that the long term effects on your entire body when you're not
Right.
taking care of it in the right way, where you're kind of looking at mental, physical, social, spiritual, all that stuff in one, it's really going to come back to bite you.
Exactly. Yeah. So when we're looking at that physical health, we want to think about things that we can do, right? Getting exercise, getting outside, a lot of the things that we've talked about in previous episodes, especially our last episode, like how can you be healthy, active out there in the world, doing your stretches. Another study that I looked at the correlation again with stress and injury, but it actually found that the highest injury prevalence are those with poor balance and increased muscle stiffness. The next highest level of injury risk was those with increased muscle stiffness and higher levels of stress than normal. So, it's finding that balance, right? Because I would have thought that, stress might have been a little bit higher, but you have to think that sometimes why are muscles stiff, right? Especially upper traps, shoulders, psoas, and your hip flexors. Those are two super common areas where we see tightness in individuals, and it's really directly related to stress and tension. When we get scared, when our body's in that fight or flight, we start to kind of tense up in that upper neck trap area. And that's why we see a lot of neck shoulder injuries and pain, as well as going down the kinetic chain. You never realize that your back pain could be coming from a stiff neck or bad shoulders. So when we think about that, physical health, getting in our vitamins, our minerals, as Jon said, can you make healthy meals for yourself? How does making healthy meals impact your overall, disease outcome, things like that? I definitely want to circle back to some awesome research on diet and its impact on depression. But we can go on to the next one because I think it kind of ties into that.
As far as the mental health,
Yeah.
so again, when we talk about holistic, we're looking at chronic diseases, right? So we're looking at the main ones: heart disease, diabetes, that are just kind of taken over. So like you just talked about, as far as stress goes, a lot of people are like, oh, understanding that, eating healthy, stuff like that. But if you're doing that and you're not, considering the mental health side of it, the stress, what stress does to your brain, what stress does to your body, and you are eating healthy and you think you're getting, good quality sleep, but you're just going throughout the day and you're letting stress, get to you, and you're not doing the right things to kind of calm down, whether it's meditation, whether it's deep breathing, whatever the case may
Or
be.
just a little time alone, a little
Yeah.
silence. Like, that's super important. Just ways to find
Yeah.
time to disconnect from your work, your life, everything that's going on.
Yeah. And I feel like that's a big thing personally. Like 10 years ago or so, I was kind of having issues because I feel like I was doing all the right stuff, but I was actually taking it too far, where I was so stressed out about eating healthy and so stressed out about working out. Even if I had a long day at school or a long day at work, I wouldn't give myself time to calm down. I would just stay in that sympathetic nervous system, that sympathetic state of that fight or flight state, and that's just not good to do. So we kind of want to focus on making sure that we're calming down, stress relief, that's big.
Yes. And gratitude, I think, is huge when it comes to mental health. You know, we are so quick to focus on that one thing that is bad or that's negative, I mean, this is kind of a funny story that just happened to us this week. Um, we were keeping our bikes because we're in an apartment in Denver in the common area laundry room because we don't want to keep our bikes in our apartment. Who wants to keep their bikes in their apartment?
And there's no bike racks in the entire apartment complex.
So I was coming home from work and I noticed the note that I put on the bikes. It was like a nice note, like, if these bikes are in your way, just text this number and I'd be happy to move them, in the hallway. And I was like, oh my gosh. So I ran into the laundry room and our bikes were gone. And I texted John. I called my dad. I was like, the bikes are stolen.
They're gone
They're
forever.
gone forever. Like, I was like immediately stressed. This just happened 2 days ago. My dad and John are my witnesses. And John was at work, so he really couldn't talk at the time. And I called my dad, and he was like, Courtney, like, you guys make good money. They're bikes. Like, at the end of the day, you kind of have to feel sorry for whoever is in that need of a bike. And, you just have to be grateful that you have the resources to go out and get yourselves new bikes. And, it's so hard to think of that at the time. Like, I was like, yeah, Dad, whatever you say. I'm gonna, try to find these bikes. I don't know what I was thinking, but it's trying to remember of all the things that we're grateful for and not focusing on maybe all the negative things that are happening. It's, why are you stuck in traffic? Because you have an amazing family that you're providing for by going to your job that might not be ideal, but there's a lot of people out there who are unemployed, and it's always hard to think that way, but it really is so helpful on your mental health. And I think that if we just really try to switch and think more positively, it's going to have a huge impact on so many areas of our life. So
Yeah,
that's my mental health caveat.
yeah. Beautifully said. And luckily, our bikes are not stolen, so they are here in the apartment
Maintenance
now.
took them because they weren't supposed to be in the laundry room.
But yeah, I mean, back to the holistic way, what this episode is about. I mean, we're talking physical. We talked about diet, exercise. Obviously, we've talked about that before. Super important. Sleep, obviously, very important. Looking at the entire thing, social health, right? That's something that we've talked about. It's big because, unfortunately, we aren't getting the same kind of social interactions on the road that we would get back home, just because our family and friends are in other places right now. But just finding time to take a yoga class or go on a hike and talk to people out there, or go just find that social interaction somewhere, because it is so important. Because you can be doing everything else right, and if you don't have a healthy social lifestyle, then you could really feel down, and then it can start impacting other things in your life.
Right. Like we have mentioned in our social connection episode. If you guys haven't listened to it yet, go ahead, listen to that. But it there there are so many benefits of increasing social connection. I mean, decreased blood pressure was like the number one that I read across the board. And what is high blood pressure related to the most? Cardiovascular incidences, heart attack, stroke. So it's like your doctor would never be like, oh, you have high blood pressure, go out and get social interaction, right? And you might need medication. We're never going to be anti medication, but where can you go and get that social interaction to maybe bring more balance into your life? As John mentioned, there's so many amazing ways to be active, get in classes or different things like that.
Definitely. And I just thought of something a little bit
Yeah,
as
you're
as you
good.
were talking there. A few of my patients recently, in the past few weeks, have come in, and this one in particular has had two total hip replacements, both hips, two total knee replacements, lumbar fusion, cervical fusion,
I couldn't
two
imagine.
total shoulder replacements. Not even kidding. She's only not had her ankles not done yet, and she's like 50 some years old, right? And I'm like, what the heck happened? Like, what's going on? And she's just like, oh, bad genes, right? Bad genes. And I've heard that a few times just in this assignment. Bad genes, it's just bad luck. Oh, old age. I mean, I know
Yeah, yeah, yeah.
you hate that one.
Ugh.
I do too, because it shouldn't have to be like that. And
Right, exactly.
although genetics and epigenetics are both huge factors, you can still, slow down that decline. You can still do a lot of things to not, develop arthritis and develop high blood pressure and all that stuff, because,
Your environment is just as impactful, if not more impactful, than your genetic makeup.
exactly. So did she have the best diet her whole life? Did she get, good sleep? Stay tuned, because I just evaled her the other day. So we're going to find out. I'm going to start talking to her a little bit more. I'm sure she's going to say, oh, I did everything fine. But
No, but it is so important, and
yeah,
it's that environmental aspect, that plays a key role. What you're exposed to, what you, you
yeah.
know, relate with, what your family does, and things like that.
Yeah.
It's so
And
important.
that's kind of my point. It's like a lot of these people are like, all right, well, I have pain, like it's time for surgery, or I have arthritis, it's time for surgery. You can treat arthritis, with exercise, with diet, with range of motion, with stretching. I mean, you can, you know, feel a lot better
Yeah.
with arthritis and still have a lot less pain without just going straight to medication or surgery. And I
No,
think that's a huge thing.
I have a family member who pretty much controls her arthritis by diet. And, around the holidays when we're having more cookies and sugar and carbs and stuff like that, she can feel it. She's
Yeah,
like, oh,
exactly.
yeah, I feel it. It's flaring up,
Yeah.
because the rest of the time she is being so cognizant of, staying away from those foods that cause inflammation, and that it just makes her feel better,
Yeah.
So that, again, it has to do with your environment, your physical health, the way you perceive that. I think that the last two personally are super like important, and they don't get enough credit. That your emotional health and your spiritual health. Your emotional health is, again, how you handle those stressful situations, right? How you react in an emotional way. And I'll be the first to say, I do not have the best emotional resilience. It was just kind of something that, we were just an emotional family
Yeah, it's
growing
just
up.
bad genes.
Yeah, bad genes. It was passed down from my mom. I mean, I love you, mom, but
Just
so
kidding, by the way.
yeah, no, of course. But it was, and it's great to be emotional, but there are times when I am having a serious work conversation with a superior, and I get overly emotional and flustered, and it's to the point where I can't, make a good claim for myself or stand my ground or get my point across because I'm getting so emotional. And then that stresses me out. And then it's kind of this cascade of things. So, one thing that I've been really doing to help my emotional health is journaling. And we've talked about it before on the podcast. And as I've probably said, we could do a whole episode on journaling, but
Which we will.
writing things out, just getting it off your mind, getting it onto paper, just is so beneficial, because then you're not getting in that emotional cycle in your head. If you do have a bad day, let it go. We talked about that in last week's episode. Write it out. Like, today sucked. This is what happened, and then end it with a little bit of that gratitude. Like, but I'm thankful for this person in my life. I'm thankful I learned this lesson, and I will go to bed and just wake up tomorrow and have a great day, and it's kind of like having that mindset, which goes into the spiritual health aspect of believing in a greater power. Spirituality and religion are not the same. A lot of people do think that. And though you can have spirituality through your religion, you don't have to be religious to have spirituality, if that makes sense. And I think that just understanding your purpose is a big thing about spirituality, and aligning yourself with, your overall ambitions and goals and passions, and understanding that at the end of the day, you do have control over your life and your mindset and your choices. And that is directly going to impact, your social connection, your physical health, your mental health, your emotional health. So, again, it is like this huge circle that every single part is interconnected. And I think that's normally how they show the diagram of holisticness is a bunch of little circles that are connected because it is just one big, connection.
Yeah. No, I love that. And we talked about the blue zones before. The blue zones, they all really touch on every single part of the
Yeah,
holistic,
no,
pie that we're
it's so
talking about.
crazy.
And in that spiritual aspect, they're very selfless. They believe in that greater good. They believe in community. They believe in that social aspect. Like I talked about before, charity work. I feel like they're all very selfless. And that's kind of why their stress levels are so low because they're doing these things for other people, and they're truly happy and grateful for what they have,
Yeah.
even though some regions, I mean, we saw some regions are not the best developed, and they're still
Right, yeah.
living to be 105 years old, and triple digits with great health, great mind and great physical abilities. I mean, it's wild, but it's because they take that holistic approach.
And two of those blue zones, are one in Okinawa, Japan, I believe, and the other is in a place in Greece. And their diet, specifically the Japanese and the Mediterranean diet, have been linked to a reduction in all cause mortality compared to the standard American diet or the Western diet. We're thinking of diets that are low in inflammatory things, so standard American diet or the Western diet has really high inflammatory foods, C-reactive proteins, and we are seeing that increased cause in, cardiovascular disease, stroke, arthritis, pain, and they're not seeing that as much in other countries that have better diets that focus on getting more healthy fats, getting, even they're saying wines and, fermented cheeses. They're staying away from those highly processed foods and high refined sugar foods. So,
Yeah, fermented bread.
yeah,
I mean,
sourdough, they're making
yeah,
their own things. I think, we could just go on
yeah, and
forever about that. So,
we're gonna have an episode here soon because we have done a good amount of research recently about pesticides and uh, different things that you may have in your own kitchen or in your own house that would be surprisingly bad for you.
yeah.
And I don't want to give any away
Yeah,
because
don't give too much away.
yeah,
Yeah.
because you're gonna have to tune in for that one. But yeah, just what you were saying. The Mediterranean diet. You want to really focus on just the anti-inflammatory, diet. You want to
Right, exactly.
obviously fruits and vegetables. Fatty fish is great. You want to get those omega 3s. So
So the green leafy vegetables, right? Everyone loves that. They're
yeah,
high
they have
in vitamin B, folate. We're thinking zinc,
magnesium.
magnesium, and
Yeah,
those minerals are directly related to, decrease episodes of depression if they are higher in your diet. So that is another study found that, vitamin B6, B12, B9, zinc, higher intake of those led to decreased depression symptoms. And another study that I came across did it's like a fancy term, across, I have to look it up real quick.
meta-analysis.
No, it was a parallel group randomized control trial.
That was my second guess.
Yeah. For 12 weeks with the two groups. So again, it was a randomized control trial. They didn't know which one was getting the intervention and which one wasn't. The intervention was a diet plan focused on the Mediterranean diet and recipes and things like that. And the control group, they didn't have any of that. They looked at their depression symptoms at the start of the 12-week study and at the end of the 12-week study. And the intervention group, so the ones that got the information on the Mediterranean diet, showed significant improvement in their depressive symptoms, according to one of the standardized tests they used. So it's like right there.
Yeah.
How can you not see the relationship between your mental health, your physical health, your social health?
Yeah.
All this is interconnected.
Exactly. And that's the thing. Like you think about diet. Okay, I'm going on a diet. Why? Because I want to lose weight. Well, going on a diet for a lot more benefits because of the holistic approach, because of that pie that we talked about, the mental, the spiritual, the social, all of that is going to be increased and improved if you're on a good Mediterranean diet or just a good overall diet for you.
Right. And I think that that's the biggest thing is that we've gotten so used to saying diet in almost a negative connotation. Like you have to go on a diet to lose weight. We're when we say Mediterranean diet, we're thinking more of the lifestyle, the choices that you make to
You're
incorporate more fruits, vegetables.
you're still getting calories, right? Like
Right. You're
people
not,
think about
yeah.
diet that you're going on a diet to restrict calories, and that's really not. You're just getting the calories in a different way because if you get calories from eating a donut or, eating processed foods, your body's immediately going to be hungry again
Right.
because your body can't use that in any functional way whatsoever other than to
Exactly.
store it as fat.
Hmm.
So that's kind of where it's coming from, getting calories from, smarter areas rather than
Right. Yeah. We've really focused on the calories in food over the last few years. And now I think we are shifting as a culture to be more nutrient dense, nutrients versus calories. And that just makes me think of Sean Stevenson, who is an amazing author, has the number one health podcast. And his start was because he had a degenerative bone disease when he was in college. And, it's, he says it's due to his poor food choices growing up. And he was eating, but it was a lot of processed foods, mac and cheese, you know, sugary drink, things like that, that he wasn't giving his bones what they needed to be strong. And that really inspired me. The minute I read his book, I was like, wow, this is so important. Why don't more people know about this stuff? And that's the whole reason why we're doing this, right? Is to get the word out there because if you can just take away one thing, like, oh, my mom had arthritis, I have a increased risk of arthritis. Maybe I can look up some different things. Maybe you can talk with your doctor. Are there ways that you can control some of your symptoms with diet and lifestyle choices, right? Of course, always consult your physician. If you're going to therapy for pain, talk to your physical therapist, your occupational therapist. What lifestyle choices can you implement today to help you become a overall more well-rounded individual in those 5 areas that we talked about: your physical health, your mental health, emotional health, spiritual health, and social health. So it's so important, and I thank you guys so much for listening in because we love educating you on this. And we know that sometimes it's like we're saying similar things over and over again, but it's because they're so simple and they're so important.
yeah,
And, it's just great to be able to give you this information.
definitely. And they're so simple and so important, but in reality, most Americans are just not doing it, or they're not,
Right.
because, like I said, for me, even going into college, and even in the last few years, like I'm still learning,
Oh, I
so
learn something every single day.
exactly. So that's the thing. We want to just kind of get the word out there about what we have learned and what works for us, what works for our patients, and if you guys anything works for you, works for your patients, or works for your family members or friends,
Yeah, let
let
us
us know for
know.
sure. But yeah, just to finish up, just taking that holistic approach, looking at all 5 pillars, thinking about, am I maximizing myself in all 5 of those pillars as far as physical, mental, spiritual, social, and emotional.
Right. And my challenge for you this week, guys, is maybe you feel like you have 1 or 2 pillars down, like where can you maybe add a little bit more? Maybe you've never really been a spiritual person, and that's okay, but can you start to dabble into thinking more of your spiritual health or your emotional health and see how that well rounds those other ones that you already feel confident and strong in? So that's my challenge to you this week, guys. Find a pillar that you can increase or maybe try to increase all of them to get that well-rounded health. Thank you so much for tuning into this week's episode. Again, we love your feedback, your comments. Please keep them coming. They literally make us so happy.
Yeah, we love it.
And as Jon said, we're going to have amazing content coming to you the rest of this month and months coming up. So thank you again so much for tuning in, and we'll see you next week.
Peace.